So when it comes to the heart sound, we have 4 heart sounds. What are those? First heart sound, second heart sound, third heart sound, and fourth heart sound. So these two, first and second heart sounds, are the classical heart sounds, and we can hear these sounds with the stethoscope, and these are the prominent sounds. Okay. The third heart sound is the mild one and cannot be heard through stethoscope. Here through stetho, and we can hear this out using microphone. Using microphone. The fourth heart sound is inaudible. It is only audible during pathological conditions and audible in pathological conditions only. Okay. So the first heart sound is the result of closure of AV nodes. As I have said, both the artericles will be contracting at the same time and relaxing at the same time. So that's why the closure and opening of this bicuspid and tricuspid wall will be taking place at the same time. So when these both walls closes, there will be manifestation of first heart sound. The closure of semilunar walls, semilunar walls is the result of second heart sound. So as we have seen, the semilunar wall, that is aortic and pulmonary wall, also be closing at the same time and they will be opening at the same time. So when they closes, there will be manifestation of second heart sound. Third heart sound manifests when there rush of blood into the ventricles. So there is rushing of blood into ventricles. And fourth heart sound is manifested as the result of contraction of arterial muscles. So this sound will be heard for the duration of 0.10 to 0.17 second. This is for 0.10 to 0.14 seconds. Third heart sound is for 0.07 to 0.10 seconds, and fourth one is 0.02 to 0.04 seconds. So this first heart sound is long, soft, but low pitched. Second heart sound is short, sharp, and high pitched. Third heart sound is low pitched, which only can be audible through microphone, and the fourth one is inaudible, so we cannot say its features. So the first heart sound is resembles with the spoken word love, and the second heart sound resembles with dove. Okay, so there are some pathological conditions when it comes to these 4 heart sound. So first we will see about the first heart sound. What happens in case of some pathological events? What are those? We will be getting 3 types of pathological first heart sounds. First is the splitting. Second is the soft heart sound, soft first heart sound, and third is loud. So what do you mean by splitting? When there is improper closure of AV walls. So when AV walls doesn't close properly. So physiologically what we want, both these AV walls should be closed and should open at the same time. Okay, but because of some reasons, if this both the AV walls are not closing at the same time, it will produce a spitting type of sound. What do you mean by spitting? You will hear two small pitched first heart sounds. So in case of stenosis of atrioventricular walls, and in case of atrial septal defect. So in these two conditions, there will be no closure of this AV wall at the same time. One wall closes before and one wall closes later. It produces two different sounds. This is nothing but the splitting sound. Second is the soft sound. Yes, physiologically, first heart sound is the soft. It becomes more prominently soft in case of some of the conditions like the reduced blood pressure, heart failure, and EMI. So the sound intensity will be reduced, reduced sound intensity, and it will give you the soft, very soft heard, soft first heart sound. Next, loud. There are some conditions where you will be getting more loud first heart sound. What are those? Mitral stenosis, acute rheumatic fever, and Wolf Parkinson's White syndrome. So we are going to discuss about this syndrome when we go into the ECG section. But just remember, these are the three conditions where you will be getting more louder first heart sound. So these are the three pathological conditions. Splitting, you will be hearing two different first sounds because of closure of AV wall one after another. Second is the soft, like in case of blood pressure, reduced BP, heart failure, and MI. The sound intensity reduces, and loud sound we will be getting into mitral stenosis, acute rheumatic fever, and Wolf Parkinson's White syndrome. So this is about the first heart sound pathologically. Now we will see about the second heart sound pathological events. So there are four pathological events into the second heart sound. What are those? First is splitting. Second is the reverse splitting. Third, loud, and fourth is soft. Second heart sound we will be getting as a result of closure of semilunar walls. So what happens in splitting heart sound? The pulmonary wall closes before the aortic wall closure. Okay, so physiologically what we want, these both the walls should be closed at the same time. But in case of some diseases, that could be pulmonary stenosis, right bundle branch block, and right ventricular hypertrophy. What happens in these three conditions? The pulmonary walls closes before the closure of aortic wall, as a result of which you will be getting two split sounds of at the second heart sound. This is nothing but the splitting. Reverse splitting is when the aortic wall closes before the pulmonary wall, like in case of diseases like aortic stenosis, left bundle branch block, and left ventricular hypertrophy. The aortic wall closes before the closure of pulmonary artery. There you will be getting two different sounds again. That is the reverse splitting. Loud we will be getting in two conditions: hypertension and coarctation of aorta. So this is one of the congenital anomaly we are going to discuss that. Remember the term hypertension and coarctation of aorta are the conditions where you will be getting second heart sound loud. Soft, we will be in getting this soft sound in heart failure. So usually this has to be short, sharp, and high pitched. But if it is become soft, then it indicates heart failure. Then third heart sound you will be getting only through the microphone, not on the stethoscope. So this is as the result of rushing of blood into the ventricles. So pathologically, we will be getting this into some of the conditions. Pathologically, it will be present in the conditions like aortic regurgitation. What do you mean by aortic regurgitation? By any means, if the blood of aorta is coming back into the ventricles, then it is aortic regurgitation. Then cardiac failure and cardiomyopathies. So in these three conditions, we will be hearing the third heart sound on the stethoscope also. Along with this, there are some physiological conditions where the third heart sound can be audible. What are those? In children and in athletes. So this is the physiological audible third heart sound we will be getting. Next, fourth heart sound, it is not audible through the stethoscope and it is always pathologically audible in stetho, like in case of ventricular hypertrophy, ventricular hypertrophy, long-standing hypertension, long-standing hypertension, and aortic stenosis. So these are the fourth heart sound and their clinical importance. So what you need to remember in this slide, what we have seen in this slide, there are four heart sound: first heart sound, second heart sound, third heart sound, and fourth heart sound. First heart sound and second heart sound are audible through the stethoscope. Third heart sound is not audible to the stethoscope, but we can hear it by using microphone. And fourth heart sound is not even audible in the microphone. You can see this on a graph. Okay, and the first heart sound is the result of closure of AV nodes, that is both atrioventricular valves. So no, sorry. It is not the node, it is the closure of atrioventricular valves. Okay. So both the tricuspid and bicuspid valve closes and produces first heart sound. Then closure of semilunar valves, that is aortic and pulmonary valve, produces second heart sound. The rushing of blood into the ventricle produces third heart sound, and fourth heart sound is contraction of atrial muscles. So first heart sound is of long, soft and low pitched. We usually heard it as a spoken word like love, L-U-B-B. And the second heart sound is short, sharp and high pitched, and it resembles like the word dove. Third heart sound is low pitch, fourth is inaudible. Pathologically, we will be seeing the first heart sound as a splitting, means you will be getting two heart sounds. Why? Because the atrioventricular wall doesn't close properly, like in case of stenosis of atrioventricular wall and atrial septal defect. Then there could be the sound intensity reduced, and it will produce as a soft first heart sound in case of reduced hypertension, reduced blood pressure and heart failure. You can hear first heart sound as a loud mitral stenosis, acute rheumatic fever, and Wolff Parkinson's White syndrome. Second heart sound is there are four pathological conditions: splitting, reverse splitting, loud, and soft. When the pulmonary wall closes before the aortic wall, it causes splitting type of sound, like in case of pulmonary stenosis, right bundle branch block, and right ventricular hypertrophy. If the aortic wall closes after closure of pulmonary walls, then we will be getting reverse splitting like in aortic stenosis, right bundle branch block, and left bundle branch block and left ventricular hypertrophy. You will be heard this loud as in case of hypertension and coarctation of aorta, and soft in case of heart failure. Then in third heart sound, physiologically it can be heard in children and athletes, and pathologically in aortic regurgitation, cardiac failure, and cardiomyopathy. Fourth heart sound, which we can pathologically hear in case of ventricular hypertrophy, long-standing hypertension, and aortic stenosis.